Hi everyone, a good day to whoever is watching this right now. We are Group 4 and we'll be presenting our case study in this video presentation. I'm Chloe and I'm here with Johan, Mohan, Vincent, and Max. Firstly, I will pass the stage to my groupmate Johan to introduce the case study that was presented to us.
So by doing an analysis on the case study, we have found that the patient is a 76-year-old woman and she first started having pains and burning sensations over the skin on her chest. Few days later, she developed a vasculopapular rash with severe pain and itching sensation on her chest, back and left side of her neck. And 3 days later, she complained of heavy and dry cough, a loss of taste and smell, and difficulty in breathing. And because of this, the doctors have to put her into an ICU so that she doesn't potentially infect other patients. Aside from the details of the patient's symptoms, we also looked into her history, and we have found that none of her family members have developed similar symptoms such as hers, as well as she hasn't traveled anywhere in the past year due to COVID-19. And a few months ago, she had brain surgery to remove a benign tumor. And now I'll pass it back to Chloe.
There are several questions I would like to ask our patient, and the first one being, were you ever in contact with anyone that is a suspected or confirmed COVID-19 patient within the past 14 days? This is because the patient exhibited heavy and dry cough, a loss of taste and smell, and also difficulty in breathing, all of these which are symptoms of COVID-19. Next, I would ask if the patient is ever diagnosed with chickenpox in the past, because shingles can remain dormant for several decades even after being infected with chickenpox. And also, I will ask if the patient is under immense stress or anxiety lately, as we all know that weak mental well-being can also weaken our immune system, thus allowing the activation of shingles. So these are the extra information that I would need to know to further confirm the diagnosis of shingles in our patient.
We're talking about the diagnosis for this case study. The probable diagnosis based on the information given was shingles. It is a viral infection that causes painful rashes or blisters that appears on the skin. The symptoms that she exhibits, such as pain and burning sensation over her skin of her chest for a few days. Vasculopapular rash was developed with severe pain and itching sensation. Not long after the appearance of rash, her cough was heavy and dry. She also experienced a loss of taste and smell, difficulty in breathing as well. All of these symptoms matches with the sign of having shingles.
Upon diagnosis, it was suspected that the patient may suffer from shingles. Shingles is a disease caused by varicella zoster virus, the same virus that causes varicella or chickenpox. The primary infection of this virus causes varicella and then will remain latent in the dorsal root ganglia once the illness resolves. This virus can then reactivate again later, causing a painful rash called shingles. The transmission of this virus is through inhalation of virus-containing droplets from coughing or sneezing, or through a physical contact with infectious skin lesions. Varicella zoster virus has an incubation period of around 10 to 21 days, and during this incubation period, the virus spreads through the lymph nodes, lungs and liver, in which this process is known as primary viremia. Then, as the incubation process progresses, the virus makes its way to the skin via CD4 and CD8 T cells, initiating secondary viremia. As the infection progresses, the formation of small skin vesicles filled with pus and infected cell particles occur on the skin surface, which is known as chickenpox. In order to confirm the diagnosis, there are 3 tests that could be used. For example, PCR, DFA or direct fluorescent antibody, and Zhang smear. PCR is used to detect varicella zoster virus DNA rapidly and sensitively, and also it is available widely. Samples could be obtained from swabs of vesicular lesions or scabs of crusted lesions. DFA and Zhang smear has a rapid turnaround time, but it is not recommended to use them due to limited sensitivity.
So now I'll be talking about the known and unknown risk factors that could have contributed to her contraction of shingles. One is her old age, where as her body grows older, her immune response will weaken and therefore she'll be more vulnerable to the disease. Next is recent surgery. So due to recent surgery, the site of incision, which is at her head, is a possible site of infection, and the anesthesia used to sedate her could suppress the immune system, and it takes quite some time for the immune system to recover. And next is the unknown factors. So there is a possibility that she underwent post-surgery chemotherapy after the removal of a benign tumor to remove all the remaining tumor cells within her brain. And because of chemotherapy, her immune cells may die off, which will lead to the further weakening of her immune system. Next is the past infection of the pathogen. People who have contracted chickenpox before will keep the virus within their body, and the virus can resurface and cause shingles when their body is immunocompromised. And lastly, mental disorders such as stress, depression can impair your immune system. So all in all of these risk factors are related to the immune system, and when your immune system is weakened, it will bring about the disease.
There are several antiviral medicines a patient suffering from shingles could take, such as acyclovir, valacyclovir, and famciclovir, presented to treat shingles by helping in shortening the length and reducing severity of the illness. These medicines are most effective if the patient starts taking them as soon as possible after the rash appears. Over-the-counter medicines could also help relieve the patient from shingles pain, and some more help with the itching reveals would be wet compresses, calamine lotion, and colloidal oatmeal baths. Varicella-zoster virus pulmonary complications. Varicella-zoster virus causes varicella, chickenpox. It can be reactivated indigenously many years later to cause herpes zoster, shingles. Progression to pneumonia risk factors include pregnancy, age, smoking, chronic obstructive pulmonary disease, and immunosuppression. Approximately 5 to 15% of the cases of adult varicella will have a type of respiratory complication. The onset of symptoms typically occurs within 1 week of initial symptoms presentation of varicella. These include shortness of breath, fever, cough, and a burning sensation in chest.
To conclude, the patient was diagnosed with shingles virus, which is caused by the varicella zoster virus. The virus is transmitted through viral infection droplet, such as coughing or sneezing, and also physical contact. The laboratory tests can be done through PCR, tank smear, and direct fluorescent antibody. Further complication, if left untreated, can lead to post-therapeutic neuralgia, skin infection, and vision loss.
So that's the end of our case study. Here is the references we use for our case study, and last but not least, thanks for watching.